So in the initial triage phase of management, what I'm trying to do is empower the athlete. So I'm trying to find exercises to give the athlete that are going to change the patterns that I've seen in assessment. So for instance, if I've seen that there's a lot of upregulation of erector spinae and there's lots of hanging on through deep multifidus muscles, I might play around with getting an exercise that helps turn these off as a test treatment and then get the athlete back up and reassess their movement patterns. So one of the exercises that I give often to patients that present with an acute episode of low back pain is cat camel, if you like. So it is popping the pelvis right down, getting some extension of the lumbar spine, and then bring the pelvis up to get some flexion of the lumbar spine. And so in standing, this might be quite provocative, that once we're getting extension that it hurts, or once we're getting flexion that it hurts. But we're doing that with a whole lot of load through the spine. Here, this is a cross gravity. Just pop that pelvis right down for me, Lucas. Great. Here, this is a cross gravity, and so you haven't got the load through the spine, and so the athlete can be quite comfortable doing this. And that on-off exercise of the erector spinae having to turn off when you come through flexion, and the deep multifidus having to come off when you come through flexion, and then them having to turn on when you go into extension, is a really nice way to get that regulation of tone under control for the spine. So this is something that I might do 5 times in each direction, might get the athlete to get back up, reassess their flexion and extension. If it's a lot better, I know that's something I can send the athlete away with that's going to help change their inhibition and their upregulation movement patterns that they present with in the presence of pain, so we can start to normalise their muscle function. And we want to do that before we return them to sport. We don't want to return them to sport with lots of splinting through their back, because it's going to load their spine even more. Sometimes the athlete doesn't really want to let go when we're doing this, and so I might try and do something different. So if it's a bit more erector spinae, a bit less deep multifidus, another strategy that I have is to get the athlete to come down into child's pose. So just take your hands a little bit further apart for me and forward, Lucas, great. And so this is bringing your bottom back down towards your heels and getting some flexion across gravity in this direction that really stretches out your erector spinae muscles, and then coming back up, which really turns on your glutes. So if you're thinking that your athlete has a lot of upregulation of erector spinae, some real inhibition of glutes, this might be a better exercise to go for. So down here, erector spinae is having to turn off as they come into flexion. As they're coming back up, they're turning their glutes on to be able to go into hip extension and come back up. So you're getting rid of some upregulation of erector spinae, and you're getting the glutes working a little bit more in this position as well. Again, you want to reassess after doing an exercise like this to see if the main asterisk signs that you found in your subjective examination are better. If they're looking better, if it makes the athlete feel better when they're moving, if it helps control the athlete's pain, they're the things I'm sending the athlete away with to do several times a day to get early control of pain. So I've told them what I don't want them to do to be able to re-irritate their tissues. So with a disc injury, it might be, I don't want you to be spending prolonged periods of time sitting. Certainly don't want you to be rowing, sitting and loading your spine, or cycling, sitting and loading your spine. If it's a bone-related injury, I might be saying I don't want you to be doing what you would usually do in terms of your throwing or your cricket. I also don't want you to be doing prolonged periods of standing, which are loading the posterior column of your spine. But I'm also trying to find something else that they can do that really normalises their muscle tone around this part of their spine as their pain is reducing down as well. So another exercise that I might choose to do with an athlete if I think that their psoas is really upregulated and really hanging on is a reverse lunge. And I'll get Lucas to demonstrate this to you now. So he's going to take his leg back, keeping his shoulders right above his hips, and then coming back up to straight again. The idea with this is as you go back, the hip flexor has to turn off, and as you come forward, the hip flexor is turning on. And you can progress that to actually be hip flexor turning off and then bringing your knee right through. So hip flexor really has to turn on if you're not getting as much of a change in your psoas overactivity. Excellent. And what I would do with this is if I thought the psoas was overactive, I would then go back and reassess my main asterisk signs in my subjective assessment. So, was it there was a lot of pain on extension or pain on flexion, or I might even be reassessing my hip flexion. So if Lucas had a significant amount of tension around his hip flexion ability, and he only had like 80 or 90 degrees, and I really thought psoas was actually stopping that, I might go and assess that as well, because I want him to be able to sit. I want him to be able to leave with more than 90 degrees of hip flexion to unload his lumbar spine. So it might not always be in the pain provocation tests you're reassessing. It might also be your asterisk signs where you know that you need to get improvement to be able to unload that back. above or below the lumbar spine when they go away, and when they can do that at home and be able to sit really comfortably after getting rid of some tension in their psoas in particular, that can actually drive a whole lot of stiffness in your lumbar spine. So another exercise that you might use in the initial triage phase, and this is an exercise I use with rowers a lot, is a low sit to stand exercise. So we'll get Lucas to demonstrate this exercise. So just cup around your elbows for us, Lucas. And what we're getting Lucas to do is really push through his heels, coming up, and then coming back down, popping his bottom onto the bench and back up again. Here, your rectus spine, you have to turn off. Your glutes have to turn on and off. So if they're inhibited or upregulated, this is a great exercise. You really have to turn on your deep abdominals to do these exercises as well. It makes you move through your hips. Your low back's not moving at all. So athletes sometimes get quite empowered by doing something like this exercise, because they're thinking they're doing a large range of motion that could be quite provocative, but actually they're moving through their hips. There's hardly any movement or load going through their back at all. It gives a real confidence to move, and confidence to move about in everyday life without splinting. And so that's what all of this initial phase is about. Unload the back to get early control of pain. The quicker we get control of pain, the quicker we get rid of inhibition and upregulation of muscles. Find exercises to enhance that. And you might need to play around with some of these exercises, but if you've done a really good assessment, got a really good idea of what muscles are upregulated, what muscles are downregulated, you can really pick where your biggest bang for your buck's going to be with one of these exercises. It's all about playing around and trying to figure out what's working for your athlete to get what you want out of the exercise. Do you want some more movement through the low back? Do you want some more movement through the hips? What's going to get this athlete back to being able to do some exercise as soon as you can?